Hello, good morning, good afternoon, good evening, wherever you might be joining us from in the world. It's fantastic to have you back if you've been before to the Global Brain Health Clinical Exchange, and also welcome to anyone joining us for the first time. We've got a really exciting session today. I've been looking forward to it. We've had people register from 71 countries around the world, so that's really exciting, and I look forward to hearing what different people have to say from their different settings. Also, just to take a moment to thank the funding we've had from the WHO Brain Health Unit and also from the University of Liverpool that have helped us to kind of get this session set up and run, and for the management from the Global Health Network. And also this month, excitingly, we're collaborating with the Global Brain Health Institute and have some of their fellows with us. So before I hand over to our chair for the day, we're going to just launch a brief poll. We'll get a sense of where you're joining us from and what your background is. So if we can have that pop up now, that would be brilliant. Just wait a couple of seconds while that comes up. And to say we'll have a speaker, we'll have a few questions for the speaker, and we'll have a panel. And then, as with every month, at the last sort of few minutes, we'll advertise opportunities to get involved with research and a conference, and also for funding. And while we're sort of waiting for the poll to come up, if you can also pop in the chat where you're joining us from, anything you want to get out of the session today, that would be great. So I think you can see now polls come up. So we'll just wait a few seconds to see where you're joining us from. Great. I can see in the chat we've got people joining us from Zimbabwe. Ferdinand Akoka, that's brilliant. Alison from Dublin in Ireland. Marla from Alberta in Canada. Amazing. So we'll close the poll and see where everyone else is coming from. From Portugal. Amazing. Nigeria, the US. Someone also from the UK. Hello. So if we just close that poll now. Amazing. And so we've got some neurologists, some medics that aren't neurologists, different healthcare professionals from different groups. That's amazing. People who support health but aren't healthcare professionals. So a big mix of regions. That's amazing. Yeah, really exciting. Okay, I look forward to getting started. So without further ado, I'll hand over to our chair for the day, Professor Mohamed Salama. He's based in Cairo in Egypt and is leading the Egyptian longitudinal study of aging, which will hopefully give us new and exciting insights into aging. So thank you very much. I'll hand over to you.
Thank you so much. I'm really excited to chair the session today to coordinate the discussion about the intersectoral and multidisciplinary approach for tackling global brain health challenges, which I think is an important, timely point to discuss. And I'm happy to introduce our speaker today, Professor Eleanor Payne. She's Professor of Medicine at Sorbonne University. She holds a medical degree in neurology, complemented with qualification in physical and rehabilitation medicine. Eleanor also has her interest and focused in merging socioeconomic and medical handicap studying, and also the impact of multimorbidities in the process of loss of autonomy. Recently, through a pilot award from the Global Brain Health Institute, she raised awareness of brain health through launching the My Brain Ruby initiative in 2019. Please welcome Professor Eleanor Payne.
So thank you very much for the invitation. I'm very happy to be here and to discuss with you intersectoral actions that promote brain health and prevent dementia and cognitive decline. So I will start with a few landmarks about brain health, and then I will show you some examples of intersectoral initiatives from the Global Brain Health Institute, including one that I created 5 years ago called My Brain Ruby. So to start with, what do we know about brain health? How can we define it? We know it's a new concept that appeared in the scientific literature 30 years ago. And so I have a first question here for you. So do you think that brain health can be defined as a uni or multidimensional state? Is it a static or a dynamic state along the life course? So please take your device and give us some answers. So you can give multiple answers. Okay. So thank you very much for the answer. So brain health is actually can be defined as a multiple dimensional state, and it's not a fixed process, but rather a dynamic process throughout the life. So here is a paper from Yao Chen and collaborators that defines brain health. And there are not so many papers that define brain health. Again, this is a recent scientific concept. And while there is a growing number of papers on PubMed about brain health, again, not so many papers define brain health. So here Chen defines brain health as a lifelong multidimensional dynamic state that, as you can see, incorporates many cognitive, emotional, and motor domains. And so, as you can see on this map, brain health is about the past, the present, and the future. And in the past, brain health includes risk factors and protective factors. So I think pointing out the role of risk factors and protective factors is really important. You will see afterwards when we discuss it in the innovative approaches. So my second question is about brain health. Does it relate about the absence or the presence of brain disease and mental illnesses? So do you think you would rather answer yes or no to this question? So please, again, take your device and try to answer this question. So we can see here that the majority of you answered rather yes to this question. And this is interesting because this is exactly what we have in Chen's paper. So I'm here showing the field results of their field work, where you can see that the majority of scientists who participated in this poll answered as you, rather yes. So it's related to the absence of brain disease. However, brain health is not a binary construct. In fact, brain health has the potential to improve and to be optimal, even in the presence of underlying diseases. And we will see that the WHO also has in mind this aspect. One of the reasons for that is that brain health is related to many modifiable risk factors and related to biopsychological determinants that we might leverage in our approaches in care and innovative actions. So brain health was defined by WHO in its recent report about optimizing brain health across the life course as follows. It is a state of brain functioning across many domains that allow a person to realize their full potential over the life course. And interestingly, it says irrespective of presence or absence of disorders. Now, there are other related concepts, and if you want to dive more into the concepts of brain reserve, brain maintenance, and resilience, I really invite you to look at some papers, such as the one from Yakov Stern about brain maintenance and brain reserve. Despite these varied definitions of brain health, we can see that there is a consensus about the fact that brain health is multi-determined and it is a multi-layered dynamic state. So therefore, brain health offers opportunities for research and actions, first to explore its components, determinant and risk and protective factors, but also to target social health inequities thanks to our innovative approaches. And that's why this topic that we want to discuss today about developing intersectoral initiatives is really important to optimize brain health. So let me share with you some example of intersectoral brain health and dementia initiative from the Global Brain Health Institutes. So it's just here a snapshot of some of the many initiatives that you can find on the website of the Global Brain Health Institute. These initiatives were performed, are supported thanks to GBHI faculty and are performed from GBHI fellows. And as you can see, they include academic but also non-academic background. So if we look at the bottom here, we can see that it ranges from very basic neuroscience up to art here. So in this project about predictive modeling of brain health and of dementia, there is basic neuroscience using artificial intelligence, biomarkers, but then the wider scope of brain health also goes beyond those frontiers and reach out to artistic creativity to engage people using dance, movement, and music. Magda will tell us a little bit more about it. Also prevention strategy to fight loneliness, thanks to the matching of young adults and elderly people. And as you can see, these many initiatives also reach out to policymakers, to the economy. So we have the brain capital grant strategy, the brain health diplomacy, also the issue of forced migration and the cognitive status of refugees. So all those initiatives are very broad and they really reach out to society in very different ways. So again, I really invite you to visit the website because there are many more of these initiatives and they might inspire you. All the common point of all this initiative is really cross-pollination between different domains in order to influence the course of cognitive decline and dementia, and in the end to optimize brain health status in people. So now I'm happy to move on to the program that I created 5 years ago, which is also an example of an innovative approach and cross-pollination. So the mybrainrobbie.org empowering approach aims at translating the medical and scientific understanding of dementia prevention into action. So we know that recent research on dementia shows that over 10 modifiable risk factors account for nearly 40% of worldwide dementias. So this means that this consequently could be prevented, and dementia could be either prevented or delayed if we act on these modifiable risk factors that you can see here all along the life. And so these modifiable risk factors include medical conditions such as hypertension, diabetes, but they also include healthy or unhealthy lifestyles, about diabetes, healthy sleep, etc., and social determinants of health. So the idea was really to move this science into a simple narrative that could be understandable for children, so a gentle, simple narrative to help children protect their cerebral reserve and boost their cognitive reserve. So in a way, the idea is really to have to empower children to protect their brain throughout their lives. So the way we do it is we have interventions in school settings. And again, the main objective is to reduce social health inequities early in life, by empowering children to have healthy, simple lifestyles to protect their brains throughout their life. So in this approach and program, we have first a video of a small animated brain called My Brain Robbie. You can find it on YouTube. Everything is free. You can also find on the website, mybrainrobbie.org, a free educational pack that helps to perform activities in school settings. We have in this program a 2 hours brain health class in schools, so for children aged 5 to 11 years old. And finally, we also perform some public health research and international outreach. So My Brain Robbie has been translated into 7 languages and is available also in those languages on the website. So as you can see here, the 7 minutes video will help children learn easy steps about 8 neuroprotective factors. This includes the importance of education, the role of physical activity, the importance of healthy diet and healthy sleep, prevention of TBI, the dangers of tobacco, drug, or alcohol, taking care of a medical condition, whatever it is, and the importance of social interaction. Now, how do we reach children? So the way we do it is to have a pyramidal multi-level training where we first train students who then will go into school settings and empower children to protect their brains. So one academic teacher will train and empower medical students who then will reach out to children. So you can see here one professor who will train 50 students will result in the end in reaching and empowering over 3,000 children. And in the Parisian area, we currently, with our partnership, reach around 10,000 children per year with this pyramidal training model. So how do we train the trainers? We have various formats depending on the audiences and depending on the time that the trainers have. But basically, we have two parts. The first part is why promoting brain health. It's a part that deals with neuroscience. And we really discuss what is dementia, how we can understand dementia, but we also give some knowledge about public health and the way that social health inequities appear. The second part is the how. So how do we promote brain health in school children and teenagers? Well, the idea is to do it in a nice way with empowering strategy, and we work with them. We engage with them. You know, this is a new generation. You can see here examples of new kind of teaching and how to get children involved actively. And we surf, so to say, on these new trends to empower children. So here are some examples of the activities that we do in school settings. So we have a guidebook, an educational pack. So here you can see, for instance, the various risk factor or protective factors that the children will memorize from 1 week to another. And in red, you can see what they did not memorize and when the students came back, what they could still memorize. Now, the idea is not only to bring them informations, but as I said before, the challenge is really to have them engage in an active way. And so we developed interactive activities so that they can really reflect on their own behaviors. So for instance, when we address healthy diet, we will make some games, but we will also address their own diet. When we address the question of prevention of traumatic brain injury, we will ask them to make a list of all the dangerous activities in their daily lives. So it goes from not wearing a helmet to sport concussions, but you know, also other summer activities. You know, with climate change, there is less water in the rivers, and so they might sustain a brain injury if they are not careful. So again, here the idea is really to have them engage and adopt or change their behavior with a nice and gentle narrative and reflection about their own lives. In this program, we also do some research, so some pre and post monitoring and evaluation of knowledge and of the propensity to change behaviors. And here, what is interesting is that we have really two target population. The first population is the end user population, so the children, the beneficiaries. I give you here some examples of the memorization of the factors, the highest and the lowest recall, according to age, for instance. We monitor the satisfaction, for instance, the willingness of the children to share the videos. But we are also interested in the trainers because there is a recapitulating effects on the trainers, here the students, who bring the messages to the children. So you can see here before the training, we ask the medical students and those students were again involved in medical study, do you think that you can modify your own dementia risk? And you can see that well, the majority of them, half of them says no or no at all. And then we asked them after the training and after their intervention and field work in the schools, what kind of lifestyle they would probably modify. And you can see here the list of the main factors that they will be more careful about. So physical activity, diet. But interestingly, you can see also that a great part of them is not keen to change their behavior. So it's interesting, again, doing this empowering approach is not only about bringing information, but also thinking about how do you change behavior in our complex world. We have a new module. So this year we just launched the superhero module that I show you here. So it all started with an article from the BMG journal during the London pandemic, which explored the aging trajectories of superheroes from the Marvel universe. In fact, if you think about Spider-Man has some healthy and unhealthy lifestyles. On the one hand, he's highly educated, he's had a lot of social interaction, he's fit, he's doing some physical activities. But on the other hand, he's not sleeping well at night because he's saving people at night. So he's not sleeping well. He's slightly depressed and he's sustaining a lot of traumatic brain injury without a helmet. And so there are many more superheroes also for children, not only for teenagers, that are interesting to study because superheroes have, healthy and unhealthy lifestyles. And this helps children to engage with this approach and to reflect again on their own behaviors. So I must say children and teenagers were very motivated to discover this healthy and unhealthy lifestyle in their superheroes. And I think it's really an example of how we can actively engage with them. So all my gratitude goes to the faculty and to the fellow from the Global Brain Health Institute who helped me and support me in developing this approach. And don't hesitate to reach out. I saw that there are more than 1/4 of people today joining from Africa, and a lot of countries in Africa speak French and not only English, so along with their own language. So don't hesitate to reach out. I will be very happy to tell you more even after this webinar. Thank you very much.
Thank you so much, Eleanor, for your lecture. It was really inspiring, and as I can see, it inspired a lot of questions. And as expected, the questions are of diverse background because our audience today are coming from different backgrounds. And I guess Magda Kasmarska, our panelist today, given her diverse background as well, so she's an artist and creative educator, and she's dedicating art in helping older adults, in addition of being or having a background in pharmacology. So I guess she will be in a very good position to answer the diverse questions with different backgrounds. So Magda, please proceed.
Thank you so much for the invitation, Dr. Salama, Mohamed, and thank you, Dr. Bayan, for the presentation. I'm wondering actually if perhaps we'd like to address some of these questions in the chat, and I actually would encourage you, Dr. Salama and Dr. Bayan, to maybe engage in these questions together. Some of these questions that I'm seeing here are very specific about dementia. And I think you as medical doctors would be perhaps a little bit better. For instance, one question that I'm seeing here is, could dementia be inherited? And at what age are we at risk of dementia? I think this is an excellent question. I know that from my understanding, there is a hereditary factor, but a genetic factor to dementia, but it's quite small. So I wonder if you would like to speak to that. And then I'm happy to continue on with some of my own work after we address some of these questions.
Okay, so Eleanor, would you like to start, or would you like me to?
I let the question to you.
Okay, thank you. So actually, it's not that tough question. We know all that genetics play a role in Alzheimer's disease and other causes of dementia, but as in many complex disorder or complex disease, genetics play only a role. So it's not familial disease, a purely familial disease. So there might be risk genes that increase your vulnerability to develop Alzheimer's disease or other forms of dementia. However, rarely we can find a pure genetic form. Most of the time, we have some modifiable risk factors that we can control, and those risk factors are increasing or decreasing the risk of developing dementia alongside genetic background. That's why we are encouraging a multidisciplinary approach or complex approach, because it's considered a complex disease. For the age or the age of who would be under risk of developing dementia, usually we tended to think that Alzheimer and dementia is only affecting older adults. But now we can see younger adults also developing dementia and Alzheimer, and what we call young onset Alzheimer's disease or young onset dementia. And this highlights the diversity of the disease. And we can say it's only one phenotype or one type of disease. We have different types with different inheritance and risk factors that can affect. So yeah, I hope this provides a simple and straightforward answer.
Thank you so much, Mohamed. And I think this is a wonderful way to segue. I did want to just ask one question that was here. And I know, Eleanor, you mentioned that you're open to conversation, but there was one question from Rachel on how can one become a trainer during these schemes? And I think I would say the invitation is to just reach out to Dr. Bayan. But I don't know, Eleanor, if you wanted to say anything before I continue.
Yes, thank you very much for this question. I currently train students from my university, but I also train students from the BrainLab Consortium, which is another associated institution related to the Global Brain Health Institute. And the idea is that I will record some videos or put them on the website, about the two parts that I presented, one on basic neuroscience and the other one about, how to coach students or those trainers from different backgrounds. So that would be the way, I think, the easiest way for people like you, Rachel, to get some knowledge about the way you could use or train in your home country and use this approach.
Wonderful, thank you so much. Well, I'm delighted to be able to join you in this conversation. And truly, Dr. Bayan, thank you for this wonderful laying of a framework for some of the topics that we're discussing, but also an excellent example of an approach that's targeting brain health from preventative space, but also through a transdisciplinary space. So I'm, as Dr. Mohamed Salama mentioned, I'm entering into this conversation from a different background as well. As you mentioned, I am a dance artist and also an Atlantic Fellow for Equity in Brain Health. So my work is working in community-based spaces to use dance as an extension of health and well-being, but also to promote social change. And a lot of that work has been in the field of creative aging. So this working with diverse older persons and with people with neurodegenerative conditions like dementia and Parkinson's disease. So I think it's wonderful that Dr. Bayan, you're kind of addressing brain health at its very early stages, and I'm addressing them at these later stages. I also, as Dr. Salama mentioned, I have a background in neurosciences. I worked for 10 years in preclinical neuropharmacology research. So I'm interested in and appreciate both of these perspectives, yes, both of these lenses, and recognize their inherent value, both individually, but also together, intersectionally. And I also see myself in this privileged position of being able to serve as an ambassador within both of these spaces for the role of dance as and the arts as an extension of health and well-being within this arts and health space, but also to advocate for collaborative practices, in not only translation of research, but also in understanding the direction and design of future research so that we can better understand how we can design programs and interventions that utilize diverse approaches, but also how will they be implemented, the usability of those approaches. And in that, I think there's a necessity for a feedback loop between various people with various points of experience, their praxis, both practitioners in the communities, artists, as well as people who are receiving the projects, whether they're children, whether they're older persons or people living with dementia. All of these individuals have valuable insights from the lived experience that can feed back and reinforce the design of future research. So I love that Dr. Bayan mentioned the Dr. Livingston's paper, the Lancet paper, that points and illustrates to us that 40% of dementia could be reduced that through various modifiable risk factors over the course of our life. Right? And initially identifying 7, and then in 2020, kind of extending them to 12 modifiable risk factors, which is, I think, a very important shift in how we think about brain health and dementia. Right? So rather than thinking as brain health, that's only something that we can implement in early childhood, but truly thinking about brain health as a dynamic state, as Dr. Bayan mentioned, as something that is plastic and changeable and malleable. And I think this predicates a necessity, not just from those of us who are in research spaces, but also from those of us in communities, which to understand that we have agency, that we can do something to support our brain health. And that's a big part of where my work lies in translation of some of this information to communities of older persons, understanding that neuroplasticity, that brain health can be accessed, and that we have an opportunity to make changes that support and positively impact our brain health at every stage of our life, even in light of a neurodegenerative condition. And so part of my work involves entering in partnership with various communities that serve older persons, whether they're in collaboration with academic institutions, for instance, with the University of California, San Francisco. I've been working for the last 3 years with their Memory and Aging Center as part of their Creative Minds project. So through that work, we're collaborating with various communities of older persons living in the San Francisco Bay Area. And one of the projects that I'm bringing there is to utilize dance as an extension of brain health. And we always begin with a conversation about the benefits of the evidence of how dance supports brain health. And I'm curious, actually, for those of you in the audience, how many of you have considered that arts or dance might be a beneficial extension to health? How many of you have considered that? And if you were to think about one benefit, potential benefit of dance for brain health, what do you think that might be? I'm just curious. Feel free to put it into the chat. What might be a benefit of dance to brain health? I'm curious.
Also, you don't have a poll. You are just asking us to respond by writing into the chat.
Yes, no poll, just chat. Feel free to either call it out, actually, or you can write it into the chat. What do you think might be a benefit of dance to brain health? Think it can reduce self and help self-expression? Great. Physical and social activity? Help blood flowing through the body and brain? Excellent. Fantastic. It helps expressing emotions, reducing stress. Wonderful. So you're already physical activity, fun, social interaction, beautiful. Wonderful. So you're actually addressing some of these multiple domains of brain health that Dr. Bayan pointed out, right? So brain health, we know, doesn't just involve our brains, increasing self-esteem, but it targets multiple domains: our cognitive, our emotional, as well as motor, physical domains, as well as our interactions with our environments. So some of the research is actually helping support how dance can benefit brain health. And I'm liking, some of us are talking about mood, psychosocial benefits, depression, social connection. And actually depression is one of the first things that we notice, I think, both from the experiences, the practice of engagement. I think when we engage in dance, that maybe that lift of mood is the immediate thing we notice. But actually research has been supporting this a recent review in Frontiers of Psychology performed a systematic review of literature, and it's illustrated that for individuals who are actually living with dementia and mild cognitive impairment, or MCI, engaging in dance significantly reduced the depression symptoms. But I like another study that is a slightly more case study of a residential community in Prague that brought a dance program for 12 weeks to this community. What I like about this particular case study is that they were they had both people who are living with dementia and people without dementia who were engaging in this together. And both of them, after the intervention, had such a significant increase in their mood that some of them were able to either reduce or go off of their medication for depression, which is, I think, a pretty profound example. Now, another thing that some of you have mentioned here is physical activity, but one thing that we haven't talked about is this connection of physical activity very directly to cognitive benefits, right? I think we're increasingly recognizing that physical activity is one thing that we can all do. What dance offers, which is very unique, is that we're not only engaging getting the benefits of physical activity, but we also have these additional multiple domains of brain health. And there's several research studies that have actually illustrated this, that have matched aerobic output from an activity that's kind of repetitive, like being on a stationary bike, versus engagement in an aerobic dance program. And of course, engaging in the dance is a slightly different intervention because of its complexity. And what they noticed is that this engagement actually increased volume in brain areas that support memory, so in the medial temporal lobes, as well as sustained a release of a chemical called BDNF, brain-derived neurotrophic factor, in the blood plasma of the participants. And part of the reason for that we think that dance might support this is because it's introducing novelty and challenge and change, which brings us back to this idea of neuroplasticity, of the fact that our brain health is plastic. And so when we introduce challenge and novelty and an enrichment, we have an opportunity to rise to that challenge. And of course, we think about this for children when we're developing, but older persons also require and have a desire to participate and engage. So this brings me to how can this work also support people living with dementia? So I think oftentimes we think about the benefits of dance and other artistic expressions purely from a therapeutic or instrumental value. And although that's very beneficial, I think that if we solely focus on just those benefits, we impoverish our recognition of the wealth of information and benefits that we can receive from artistic practices. So some of our individuals here have talked about self-esteem, fun, happiness. There's benefits outside of some of these quantifiable experiences that result in the promotion of selfhood, in extending embodied communication, and supporting a new definition of meaning and purpose finding and community building, which I think especially for people who are living with dementia is really pivotal. So my invitation for you is to explore some ways that perhaps you could extend and identify some relationships within artists in your community to explore ways to design and implement some of these artistic approaches in your communities. I'm curious if we have any other questions from our audience.
I can see there's a question in the chat, and it's from Jeremy, and it says, "What's the difference between amnesia and dementia?" Perhaps I could put that to you, Eleanor, or Mohamed, who would feel more happy.
I think I will give the stick to Mohamed.
It's a very nice question. I'm giving recently a course to undergraduate students, and I was introducing the topic of dementia to them, and their understanding is disturbance or impairment of memory is an equivalent to dementia. So most of the time they think that the whole picture is some amnesia or some disturbance in memory, and then we begin I begin to describe to them that actually memory loss or disturbance of memory is one of the features of dementia. Dementia is a big umbrella, including different cognitive impairments and disorders. Maybe the memory loss is a first alarming sign. Maybe the memory loss is one of the features. Most probably it's one of the most prominent features. That's why it's always aligned to dementia, but certainly an isolated memory loss is not equivalent to dementia because, as I mentioned, dementia has several features and different phenotypes. So in principle, to diagnose dementia, you need more than only evaluating the degree of memory loss or impairment. As I mentioned, dementia is affecting all different functions. Some of them are executive functions, some of them engagement function. One of them is a memory. So I don't know if this answer is sufficient or not, but it summarizes a misconcept or identifies the overlap between our understanding or the lay person's understanding of dementia and what is really dementia.
Thank you. I'm seeing a question from somebody asking about how wide is access to these complementary approaches outside of higher income country settings like the United States? And that's a fantastic question, and thank you whoever asked it. I wanted to draw the attention to a couple initiatives. The World Health Organization, in conjunction with Dr. Fancourt, published a paper on the importance of arts and health, and not just in brain health, but across many different health domains. And I think as an extension, a World Health Organization has actually created a unit that focuses on the intersection of arts and health as a pillar of health and well-being. And there's a new initiative that's been launched in conjunction with WHO, the Jamil Arts and Health Initiative, and the NYU, New York University, that's also centering this role. And the big focus of that work has been to influence and support the growth of these initiatives in lower middle income countries. Kind of understanding that there's a pivotal role of arts and within health that is unmet, and there's a need to mobilize and engage these communities. And actually, I want to do a shout out to a colleague, another fellow Atlantic, a fellow for equity and brain health, Kunle Adewale, who is a part of this work. They're currently working on a project, a global arts and health and please remember, Mohamed, if you can remember the name of it. In Southeast Asia, I think.
World South.
Yeah, in the global South. In the global South. Thank you. And I believe it's actually going to be launching in Egypt in September, I think. I'll search very quickly for some of those links and put them in the chat for those who would like to be engaged. Also, I know that Kunle facilitates a global arts and medicine fellowship, of which I have been a mentor and facilitator for the last 3 years. And this is a service that brings together medical practitioners and arts practitioners, and in some cases, people who overlap those roles, to come together to share in resources, to expand some of their tools, and to also collectively support one another in developing an intervention, a little pilot project that they can bring into their communities. So maybe the access in the community where you are currently located might not at this point exist, but now I'm extending the invitation to you to seek out some of these opportunities and maybe be the person who does spearhead it in your community. And we're here to help cheer you on, to support you if you would like some access to resources, information, or potentially some ideas of how to get started.
Thank you very much. Magda, I was thinking, just listening to your very nice talk, about the fact that indeed those all those art approach really reach out to society at large. And so when listening to you, we really capture the fact that the person, the artist, engage with people who have dementia, but they also can engage with everyone, so whatever their brain function, and they also get this ricocheting effect for themselves. So that's a nice way also to wrap up the fact that, you know, if many of these initiatives expand, there will be many ambassadors who will get the benefits for themselves and also for the community they are in charge of. And there, I also want to add something about the intergenerational link, because we can see that in your program, for instance, where there are different generations, or younger adults, dancers, maybe who engage with more elderly people. But I want to mention that it's always bidirectional. So, for instance, in my experience, in my program, so the children get the knowledge, you know, are empowered about brain health, but then they will reach out to their grandparents. So they themselves become ambassador of those messages, you know, they have these messages for themselves, but also they can, you know, ricochet on others. And I think those bidirectional dynamic relations are really interesting and help also all those initiatives to spread. So I really invite you to consider all those multi-directional links that can also help reach out many people in different ways, whatever the backgrounds, art or neuroscience, etc.
Oh, thank you so much for bringing the intergenerational lens into this conversation, Eleanor. I think this is vital, and especially when we think from a perspective of brain health. I speak about this quite frequently. Social isolation is a pandemic, especially amongst youth. You know, our Gen Z generation. So we're thinking, you know, late teens into the mid 20s is actually experiencing a high level of loneliness. A recent survey, I think, identified anywhere from 70 to 80% of these individuals recognizing that. And we understand how serious of a health issue this can be when this is chronic over a life course. And I think we enter into this conversation when we think about older persons. And I think truly in today's society, we have become so siloed and segregated based on age and various other professional division experiences. As a result, I think loneliness has actually become quite a huge problem. So supporting opportunities for us to come together across ages in intentional ways, I think has ripple effects that end up supporting our brain health. And I think truly the best way to support this is, rather than having somebody to come in as an outside expert, is to empower individuals to recognize their own expertise. Because if they feel the agency and they take on this information, they take ownership for this information, then they become, as you said, ambassadors. And they end up sending that into the relationships that are in their circle of care and opportunity. Yes, this is fantastic that you mentioned this. Thank you.
There are actually so many questions in the chat. It's hard to know which ones to pick. But I can see there are questions about whether there are treatments or supplements for dementia. I don't know. Eleanor, would you like to take that question? What treatments are there for dementia?
Well, again, Mohamed, I will let you complement my answer, but currently I think there is no magic pill, so to say, to revert dementia. And that's why investing in our brain capital and brain health is so much important, because as we already said, about 40% of dementia cases worldwide could be avoided, prevented or at least delayed if we work on those simple health risk factors. So I think this is really important to take that into consideration, because if we strengthen our brain, if we protect our brain, we can, really have a very nice way also to prevent dementia. But I say nice because Magda really showed up how gorgeous all those experiences about dance, about, fighting social isolation are really also, not only therapeutic avenues, but they are really nice experiences. And so I think this is really important to stress that. But I hand it over to you, Mohamed, for the complement of my answer.
Thanks, Eleanor. So actually, I have two important points. First, as you mentioned, now we are switching from searching for the magic pill or treatment that can improve everything and cure dementia to something that improves the quality of life. So improving the quality of a patient life and having his dignity preserved is the first priority now. Second, which is another important point, is that dementia is not a disease. Dementia is a group of manifestations that can be presented in several disorders. So when we are talking about treatment for dementia, are we asking about Alzheimer's disease? Are we asking about frontotemporal? Are we asking about vascular dementia? So we have also to think accurately what type of disease we are trying to cure. In principle, in the future, you can find a new treatment for Alzheimer's, for example. This will cure many of the cases of dementia, but this couldn't be a complete treatment or cure for every single case of dementia. Yeah, I guess those are the points I wanted to add. Thanks.
What I appreciate about this point, Dr. Salama, is the understanding, again, the necessity for us to translate and share broadly the ownership of one's brain health across the life course. That this is, rather than thinking about once we arrive in a certain space to seek out these magic pills, as Dr. Bayan said, but instead to take ownership across our various stages of our life course. And I think not just for individuals, but also for people in policy, people who are making decisions on where do we allocate resources of a community. And it's exciting to see that we are beginning to shift in the direction of prevention. Because this is from a practical standpoint, when we think about dementia and the incredible cost that experiencing dementia and supporting dementia is bringing to our communities. If we can allocate some of those resources to prevention, we have an opportunity to actually have more wealth in our communities. And I love, Dr. Bayan, you mentioned this conversation of brain capital in one of your intersectional projects. So understanding how, if we think about where we shift our resources towards preventing and extending brain health from childhood across the life course, that our societies actually end up benefiting, both from an economic standpoint, from a social capital standpoint, as well as from a health standpoint.
Thank you, Magda and Eleonora. I guess we're heading to the hot topic now, which is the opportunities part, where Greta will be sharing some opportunities for our audience. So.
Thank you very much. It almost feels like a shame to interrupt. It's such an interesting discussion and there are lots of unanswered questions. So if anyone wants to pop answers in the chat, please do. And also the opportunities are also in the chat. We've had links to the Global Brain Health Institute, also to the WHO iSupport tool sent by Katrin Siher within the WHO. So please do have a look at those links in the chat. So I just want to emphasize that the Global Brain Health Clinical Exchange, it's not just a webinar, it's a way of connecting people and having, tools or collaborations that come off the back of it. Every time we finish, I'm full of ideas, and I think I can tell from the chat that lots of other people are too. So please link in and find ways of having projects that come off the back of this. We've so far had a couple, got a bit of extra funding. There's lots we can do, so please do link in. The first thing to mention, a specific opportunity, is through the Encephalitis Society. So, we work within the Infection Neuroscience Lab. So this is a kind of area of particular interest to me and links in with discussions about cognition as well. But they have each year the Encephalitis Conference, which is in December and is in London, and they've just opened for abstracts, and there are 3 bursaries available for people, health or medical professionals based in low middle income countries who want to attend the conference in person, which will include money for travel, accommodation in London, and free entry to the satellite meetings. So have a think about whether you've got any work that might link to brain health or inflammation or encephalitis that you might be able to share at that conference. The second thing is funding opportunities. So this is the Brain Initiative. It's through the National Institute of Health in the US, and it's a research resource grant for technology integration and dissemination. It's a bit it's hard to kind of cut through the jargon of it, but essentially this is about dissemination of technology and tools, about allowing existing resources to be available on a much bigger scale. So if you know of a tool or have a tool that you think could be disseminated and could be of good use around the world in promoting brain health, then this is something you could target. And regardless, have a look at the Brain 2025 scientific vision and the initiative to get a sense of what's going on in that space. So we don't quite have a link for this yet, but there's been discussion that within the WHO Brain Health Unit, there's a real appetite to get consultants from all over the world when we want to collectively implement the intersectoral global action plan on epilepsy and other neurological disorders. This only works if there's people involved all over the world in different settings who can share their experiences and make sure that whatever we do is available for everyone. So stay linked in, and if you sign up for the registration for our next session and are happy to be emailed, we can then have you on our within our network and can contact you when we know more about those opportunities. We want to acknowledge the funding that we've had from the WHO Brain Health Unit and the University of Liverpool that's meant we can keep this initiative going. And finally, later this month on the 26th of May, we've got a session about building capacity in global neurology. We'll be focusing that on the brilliant team in Zambia, and Mashna Chomba will be speaking and sharing about how they've increased capacity in their setting. So thank you very much. We will close there. And thank you very much to our absolutely brilliant chair, speaker and panel. Thank you to everyone that's put a comment in the chat. This is only possible because people comment and share their opportunities and their questions. And so we'll all say goodbye. Thank you very much and goodbye from me.